Have you been exposed to the HIV virus and you're worried of contracting HIV infection? Worry no more, because in today's video we shall be looking at HIV Post Exposure Prophylaxis, commonly referred to as PEP. Don't go away. So welcome back to Community Medicine, a channel we discuss matters health. Thank you for your continued support, and kindly don't forget to subscribe, to like, and to share this video. So HIV post-exposure prophylaxis, commonly referred to as PEP, is a preventive treatment for HIV infection after potential exposure to the HIV virus. So PEP should be taken as soon as possible and not later than 72 hours for it to work effectively. So it should be taken for a duration of 28 days consistently. In Kenya, what we normally use is a combination of 3 drugs, which are actually the same ARVs that are normally used for management of HIV infection. So PEP prevents the HIV virus from multiplying or replicating and spreading throughout the bloodstream or throughout the body. So one can accidentally get exposed to the HIV virus through healthcare work. So for example, a healthcare provider can get exposed to blood or body fluids that are contaminated with the HIV virus, and this can happen either through a needle prick or a prick by any other sharp object, and it can also happen in case body fluids that are contaminated with the HIV virus splashes either on the eyes or the ears or on the oral cavity. Exposure outside healthcare work may happen in case one has had unprotected sexual intercourse, in cases of a condom burst, in case of sexual assault, or in individuals who normally inject drugs in case they are sharing these needles. So once you've been exposed to the HIV virus, make sure that you go to the hospital, to the nearest hospital or health facility, and explain to the available healthcare provider that you've been exposed to the HIV virus. Remember, we say that PEP should be taken as soon as possible after the exposure and not later than 72 hours for it to be effective. So you should treat this as an emergency. So explain to the available healthcare provider that you've been exposed to the HIV virus, and then after taking a proper history, or after proper history taking, they'll be able to determine if the kind of exposure poses significant risk, because there are some exposures that do not pose a significant risk. For example, if you've had unprotected intercourse with a HIV positive individual who has an undetectable viral load, meaning that the amount of virus in their bloodstream is not detectable, is too low. So for this kind of an individual, the chances of infecting your partner are almost nil. So this does not pose a significant risk. And also, if you've had a splash of certain body fluids like tears, saliva that is not blood stained, urine, these are body fluids that do not expose you to the risk of acquiring the infection, as opposed to body fluids like CSF fluid, like the semen, the vaginal secretions. These can put you at a risk of acquiring the HIV virus. So the healthcare provider will be able to determine if your kind of exposure poses a significant risk, and if it does, they'll check your HIV status, because again, if you're HIV positive already, you'll not need to take PEP. Rather, you'll be started on HIV management, which entails counseling, and also you'll be started on ARVs. So if you do qualify to take PEP, the healthcare provider may also run some tests, for example, the kidney function test, to check the function of the kidneys, because there are some ARVs that should not be taken by someone who has certain conditions like kidney issues, because they may worsen the already existing condition. So after all that, you'll be initiated or you'll be started on PEP, and you should take these for 28 days consistently without fail. So if you decide that you'll be taking your PEP every day at 8 p.m. Make sure that you do that consistently. You can even set a reminder in case you forget to take your medication. And if you forget to take your medication for a duration of less than 24 hours, you need to take the next dose as soon as possible. But if you forget to take your PEP for more than 48 hours, then PEP will be discontinued. Now, dosage of PEP depends on the body weight. So your healthcare provider will take your body weight, and they'll be able to make the right choice of medication for you. So some individuals may experience some undesirable side effects after taking PEP or after they have started taking PEP. For example, nausea, vomiting, abdominal discomfort, diarrhea, headache, skin itchiness, body weakness. But these side effects should go away after some time. But in case they don't go away, you need to go back to your healthcare provider and explain this to them, and then they'll be able to advise you accordingly. Another thing is that once you've started taking PEP, you need to go for follow-up after every 7 days or after every week. So you can go on day 7, day 14, day 21, and even on day 28, so that your healthcare provider will be able to monitor your progress. Thank you very much for your time. Kindly don't forget to subscribe, to like, and to share this video, and make sure that you stay safe. Bye bye.